Hi guys, my name is Zach Bazook and I'm a third year kin student. One interesting fact about me is that I have a fascination with history and I worked at a museum this summer because of that. The injury I'm going to be discussing today happened to me when I blocked a slap shot during a hockey game. So the mechanism of injury was a compressive force brought on by a direct blow from the hockey puck. My body positioning during this event, I was facing the opponent about 10 meters away roughly in an attempt to block the shot. The direction of force was in the anterior position and the velocity of force was high. The environmental factors, this was played on ice which has a low friction coefficient, which possibly increased the velocity of the slap shot and increased the likelihood that I would be injured from that shot. The equipment, so I was wearing a standard hockey pant which has a hard plastic shell over top of a thin foam pad. And a possible risk factor for this injury was that my hockey pants were slightly outdated, which could have provided suboptimal protection to my quadricep during this event. So this was an acute injury because prior to the injury I had no antalgic gait, but following the injury I did. I also noticed that when I removed my equipment I had severe ecchymosis in the area, which was accompanied by a decreased range of motion and swelling as well. So based on these factors, I would hypothesize that this was a second-degree quad contusion injury. So return to sport for this injury is 4 to 6 weeks depending on the severity. Treatment for this injury should be the Price principle, and emphasis should be placed on putting the quad in a maximally flexed position, which reduces the likelihood of a hematoma forming for the initial 24 to 48 hours. It should also be noted that if an athlete who suffers this injury returns to sport too quickly, they could suffer myositis ossificans, so they should not return too quickly from this injury. Thanks guys.